We have had so much success solving TMJ issues. So when somebody's got a jaw that's clicking and popping and grinding, or you may even notice that your teeth are shifting, so that's no good. And that is not only associated with the TMJ joint not being aligned correctly, but it has so much to do with posture and also the alignment of your cervical vertebra. So the neck bones all need to be in place to support the head properly. So I'm going to show you several ways in which I correct the TMJ problem, taking the entire skull and the neck into consideration. So the first thing I'm going to do is make sure the spine's properly aligned. So what that means is I'm going to adjust the cervical vertebra to make sure they're all in the proper position to adequately support the neck. When they're not, the nerves become pinched because the bones are pushing on them. That's going to cause the muscles to fire, and that's also going to contribute to the neck and the jaw not being in the proper position, and they're not working together. So of course we're going to do the chiropractic adjustment, and then we're also going to do trigger point work. So I'm going to use my hands, in particular my fingers, and really work on those trigger points outside of the jaw, in particular the occipital muscles, so the muscles right in the back of the neck, right underneath the skull, because they can become incredibly tight. And again, when the muscles are tight, all the bones are pulling in the wrong direction as well. So that's what I would do with our lovely assistant, Linda. So I'll follow up the spinal adjustment that I do with my hands with an instrument. This is called an Arthrostim. So it's a chiropractic instrument. There's several attachments, but this one's in particular really good for the TMJ. And what I'm doing, Linda, if you just turn your head for a sec. Thank you. So I'm going to pinpoint exactly where the TMJ joint is out of alignment, and then use this instrument to gently nudge the bones into the proper position. And it feels like just very light tapping. It's very, very gentle. And I would do this on either side. So Linda, if you turn your head that way, and I would repeat the same thing on the other side. The trick though for me is figuring out which bones are subluxated or out of alignment relative to the cervical vertebra, and making sure I target all of them and get them in the right position. So we release the trigger points in the neck and also underneath the skull. But what's incredibly important is working on those trigger points, those tight muscles inside of the mouth. So of course, with the patient's permission, I'll work on the muscles right in the back of the jaw here. So I have a little thing called a finger cot. You can make all the comments that you want, but that allows me to go inside of the mouth, and you can open your mouth. And I find those trigger points that are those taut, really fibrous areas. Sometimes you feel like a muscle bundle. It feels like a lump of muscle. And when those muscles, in particular the pterygoid muscle, is too tight, our jaw clamps down even more than it should, and then that causes all sorts of pain over time. So I work on either side of the jaw. It doesn't necessarily feel wonderful because we're working just like a deep tissue massage on those tight muscles, but within just a few seconds, the muscles calm down, they relax, and patients report they can open their jaws with so much more ease. Now we're going to use technology. So this is a Class 2 laser. It's an incredible piece of equipment. It has about 500 protocols for different conditions. There's one in particular for TMJ, and there's a red beam that's emitted from this device, and I'm going to use that along someone's jaw, oftentimes along the neck, the cervical vertebra. And what the laser does is it helps reduce inflammation. The tissues become more metabolically active, and the more energy or more metabolism there is, the quicker the healing process occurs. So you don't really feel any heat with this. Again, I hold this so it's not going towards the eyes, of course, but it's about a minute protocol on each side of the jaw. And this Class 2 laser is incredibly powerful for not just jaw issues, but also cranial issues, when someone has migraines, when they have sinus issues, and so forth. All right, why are we wearing sunglasses? Because now it's getting real. We've got a Class 4 laser, and this is incredibly powerful. So we have to wear protective eyeglasses. Linda's got sort of fake baked sunglasses from the 1990s, and I have wraparound special cool rock star glasses here. But the Class 4 laser, let me just turn this on real quick. The particular light frequency penetrates through the bones, through the muscles, through the tendons, and again, the tissues become more metabolically active, When they're more metabolically active, the tissues heal faster. So not only do we want to make sure the structure of the skull and the jaw and the neck are in the proper position, we want to make sure all those tissues are less inflamed, that the muscles can relax, and that you can actually open and close your jaw properly. So what the laser looks like, Linda, if you turn your head this way towards me. Oh, you can't see, you have glasses on, okay. And so again, I hold this so it's obviously not going towards her face, or towards her eyes rather. And it'll feel like a little bit of heat. It's not strong, but I have to move this around. And oftentimes, not only will I address the TMJ region, but also the cervical vertebra. So the bones of the neck are also incredibly inflamed and irritated when there's a TMJ problem. But then also we address the shoulder muscles as well. So Linda would be sitting, and we would make sure that we get her traps, we get her her neck muscles in the front, the neck muscles in the back, and really make sure that they are able to relax and the inflammation subsides so quickly. So we do that for about a minute on either side. You can bring your head back up. And what's just been amazing with laser in particular is that the manual adjustments with my hand or an instrument work amazingly well. However, this just accelerates it when somebody's had chronic jaw issues for years. And then we do just half a dozen sessions of the laser, the neuromuscular re-education. My patients are opening their jaw, there's no clicking or popping. Not only does their neck feel better, but also their shoulders relax. So again, I'm looking at the whole picture. I'm not just looking at one little bone here. I'm making sure the entire spine is aligned, but that all the tissues can calm down, all the inflammation leaves the body, and that most importantly, somebody can use their jaw properly, that we don't damage our teeth, or that we don't lose teeth, or that we're not in chronic pain. And so if you ever have any TMJ issues, please give us a call. I'll be happy to help you, and I can show you what I do here. Thank you.